Hi everybody, I'm Josh with Balanced Body Rehab, and this is my foam roll. The foam roll is one of our favorite exercise tools we use as clinicians in the office because you can do so many different things with it. You can use it to self-massage your tissues and roll them out. You can use it as a stretching tool. You can use it as a strengthening tool or for stability. There's so many different things you can do with it. It's pretty versatile if you just choose one tool for a lot of different things. So I wanted to show you today a few routines of things you can do for releasing stretching on the foam roll. We could make a whole series out of this, but we're going to show releasing stretching today. But a little disclaimer, if you feel that you're an individual that is maybe in the fragile category or that you're very injury prone, the foam roll might not be your first option. Okay, we don't give this to everyone, especially people that have low bone density, osteoporosis, or any kind of major sensitivities of the nervous system. This might be too much too soon for you. So definitely consult a professional if you consider yourself to not be in the fit category. So just another rule of thumb is when you're doing any of these exercises, pain can tell you a lot in your body. If you're feeling pain, then it's probably means it's not something good. So steer away from pain, make sure you don't injure yourself. But I'm just going to show you a series of things that we do. Doesn't necessarily mean it's perfect for you. It might be perfect for another person, but listen to your body. Okay, so I'm going to show you a series of things you can do just starting on your back. And what I like to do is it's very simple, just put it at your neck and then just roll your neck side to side. Helps with increasing mobility of the cervical spine. You can nod your chin up and down, just loosens up all those tissues that tend to get tight with forward head posture. So that can be very useful, okay? Moving down, place it at your upper back here, okay? And I see a lot of people when they put it at their upper back, they end up bending way over top of it, okay, and getting a big stretch there. We like to do that with a pool noodle, a smaller diameter tool, but a foam roll is too big really for your thoracic spine to be doing that kind of bending on, and it can really cause injury to some people, and so we try not to advise people to do that. So instead, you cross your arms over your chest, you keep your abs engaged, keep a little bit flexed there to keep yourself protected, and when you're on this, you can do some little movements back. See, I'm bending my spine a little bit back at each segment, then I move up to another one, and I can do that again at that segment, or maybe I want to roll side to side, or just wiggle up and down. All that's okay, but keep your abs engaged and keep yourself safe. You can do that from your upper back all the way down to your lower rib cage, right down in here. But I don't want you to go below the level of your rib cage, okay? So maybe, keep it, a couple inches above your belly button there, and don't go into the lumbar spine too much, because that's a lot of your upper body weight on your lumbar spine when you're in that position can really put a lot of stress, shear force on your spine. So I see a lot of people getting injured like that. So if you want to roll out your back, do it on a wall, but be careful about rolling out your lumbar spine on the foam roll because there's a big lever there and that can cause some strain. Okay, so moving down the chain from this position, again, you can use it almost everywhere, but you gotta use common sense when using this. Okay, so then you can roll it on your buttocks, and really on the buttocks, it's about anything you want to do. You can get on there and wiggle it because it's not just rolling it out, but you want to create shear force on tissues to create some improved soft tissue mobility there. So you can wiggle back and forth, you can twist on it, and just get it really different any arrangement on the glutes. Moving down farther, and at home when you're doing this, take your time. If areas are feeling more tight, I'm just showing you examples of what we teach. So you can roll this on the hamstrings now, and you can roll on the outer hamstrings and the inner hamstrings. Okay, you've got two inner hamstrings and one outer hamstring, and so you can roll all those out. Okay, and then moving down the line, you can put it at your calf muscles, and you can do just one leg on it, like so. But if you need a little more force, like I do, then cross one leg over the other and lift yourself up if you're able, and roll out your calves that way. If you're not strong enough to do this, then there's a lot of other tools, massage sticks, lacrosse balls, things like that that you can use to loosen up the calves too, that work well. But this is just an option for you. Okay, so you roll it out. So notice I'm rolling up and down, but now I'm going to take my legs, I'm going to twist them back and forth like this. Again, because our muscles are three-dimensional and there's restrictions in every different direction. So we want to hit everything and really get after them there. I love to do this before running. Okay? Okay, and then of course you could do that on the other leg and switch to the other side, but I just want to show you some examples. All right, so now what I'm going to do is take the foam roll and show you some side lying approaches. So you can take the foam roll and start it at your armpit right here. You put your hand behind your head to protect your neck, and then just gently roll it back and forth. Sometimes it may not feel like much, but as you roll it, it allows the foam roll to sink into those tissues. There's usually a lot of trigger points here in the armpit area if you keep it right near your shoulder blade. So see how I'm reclined back just a little bit so that the muscles of the shoulder blade are really getting work there. And that's a good workout for those muscles that are chronically usually tight from being bent over a computer or working at a desk for a long time. Okay, if you find a trigger point, which is a bit of a sharp area, it should feel like a deep ache, then sit on there and you can do some variations here. You can pump your arm like you're honking the horn on a choo-choo train. You can wiggle it back and forth like you're throwing a ball here. And that'll all really grind on those trigger points where the foam roll is sitting and help loosen it up. Lots of different variations. You can roll more on your back and hit the posterior deltoid there and some of the different scapular muscles. You can also take it and roll it down your side a little bit to work on the rib cage there. But this is where you have to be careful because the rib cage can be very sensitive to pressures like this, and you can literally injure yourself if you put too much body weight on it. So know your body and don't go too deep on this. I'm only going a little bit of ways down, and I definitely don't want you going so far down that you're on those lower ribs that aren't supported very well. There's some floating ribs on the bottom of your rib cage, and they aren't supported very well, and if you're rolling on those, you could literally fracture those or injure those. So stay off those guys and just kind of work in that armpit area where your shoulder blade is, where you've just got a little more stability and less risk of injury there. Okay, very good. And so you can roll all that out, and definitely always have your arm down. Don't try to put excessive weight on here trying to get the stretch. Okay, we say we never use the F word in the clinic. We never force anything. So if it's just not happening, it's probably technique, or the muscles don't need something, or maybe need some other strategy altogether. But don't force anything on your sides here, because we've had a few patients that have strained themselves from trying things too aggressive there. So be careful with this maneuver. Okay, now moving on down, you can again use it on the outside of your buttocks now because you're in a side lying position. And position, there we go. And so you can use it right there, and that's hitting your TFL, the front hip flexors a little bit. Okay, and then going on down, the popular IT band. If you take your top leg and roll it over, then you can get on your IT band. I'll try to get my leg out of the way so you can see. So I'm rolling up and down on that, and that hurts. That's a lot of pressure because it is squashing your IT band right on top of your femur there. But again, we're trying to get mobilization of tissues in multitude directions. So I don't have people just roll on top of that. I'll have them stay on there and then maybe wiggle themselves back and forth a little bit there too, because that really gets more mobilization there. Lots of different ways you can release the IT band. If this one's too painful, if it's not your cup of tea, then we can try a massage stick, different maneuvers to loosen up the quadricep and the hamstring off the IT band. The IT band itself is a little too dense to actually unlock. So we just try to teach people to mobilize the tissues around it, which improve the mobility overall. All right, so that's the IT band. Get it there. Of course, you could then roll on your belly and roll out your quadricep like this. And while you're on it, you find some trigger points and you can move your leg up and down, and that really nails it. It's called an active release technique. When you find a trigger point and then you move the extremity to challenge it a little bit. So that's a fabulous technique there too. Of course, there's some techniques for your abdomen and your chest and rib cage there, but those are best advised from a clinician that you're currently seeing, because those can be a little bit risky as well. So I hope this information helps you. If you need any additional information, please give us a call at 314-780-9759. Check us out on our website, www.balancedbodyrehab.com. Thank you.